Good morning, everyone. So we had our first positive case late yesterday afternoon. We heard about it. The case is a male in his 30s who lives in Elgin County. He was infected by a close contact who resides in another region. He was assessed and tested at the London Sciences Health Centre. He was then released to self-isolate at home. He and his contacts are being monitored by Southwestern Public Health through our communicable disease team. And that's the case. Our recommendations do not change to the general public. They continue to be to practice excellent hand hygiene and to practice respiratory etiquette, to cough into your sleeve and not in your hand, or even better yet, if you're coughing, to stay at home. To stay at home as much as possible, and if you must go out for groceries or other essential outings, keep a distance of 2 meters between yourself and the nearest person, and regularly clean and disinfect high-touch surfaces, doorknobs, phones, keyboards, light switches, etc. And it's essential for the 14 days following the March break that everyone who traveled outside the country self-isolate themselves for 14 days. Now I'll open up for Q&A.
Hi there, it's Natalie again. We will be taking any questions to John Payne from Rogers TV Woodstock.
Okay, I'm just curious if this means that people in our community have to be even more vigilant, or are we still at the same level that we were prior to this?
So a week or two ago, our risk level in the community was low. We have noted in communities around us evidence of the COVID-19 spreading from person to person within those communities, where cases cannot identify that they have traveled outside the country. And so we are aware that this could begin to happen in our communities as well. So I think the risk has gone up from low to moderate. And that does require that our community citizens be more attentive to the recommendations that we make, and that they do try to keep the 6 meters from one another, that they do stay at home when they have cold symptoms. And by stay at home, we really mean stay at home. If possible, get other people to run your errands for you so that you don't have to go out. So yes, I do think we need to all be a little bit more diligent about adhering to the advice from public health.
We'll take our next question from Ian McCallum at MyFM St. Thomas.
Dr. Locke, do we know whether this, because Elgin County is such a large area, whether this resident may have been in St. Thomas, or can we zero in on the location a little bit?
Due to privacy issues, we can't do that, but we can say that the public health unit is following up on all the contacts of that individual, so that if you're a community citizen and you do not receive a call from public health, then you were not exposed to this individual and you should have no concern.
Okay. Can I ask a couple more here?
We have time for one more question, Ian, before we have to move on to other reporters.
Do we know at this point, people are asking us, how much testing has been done in Elgin as far as administering the COVID-19 test? Has there been a significant number of tests?
Among all the geography of Southwestern Public Health, we have done 120 tests so far.
Okay, great, thank you.
Thanks, Ian. We'll take our next question from Kathleen Sailors, Woodstock Sentinel Review.
Yes, hi there. Thank you, Dr. Locke. I just wanted to find out what the status is on an assessment or testing center. Now that we have had our first case in the region, are there plans to open an assessment center in the area in the immediate future?
All of our hospitals in the Southwestern geography have plans in place for assessment centers. Whether they open or not is a decision by the Ministry of Health at a higher level. At the moment, our hospitals are actually seeing lower volumes than normal because I think people are staying away. So we have sufficient capacity within our emergency departments and with our primary care providers to assess patients. So although our hospitals are ready, we will need to wait until there are sufficient signals that indicate that we do need to open them before they are opened. And along that note, I'll just remind the general public that even though we are all concerned about COVID-19, that if they have an illness which requires an emergency assessment, such as chest pain, which might suggest a heart attack, or other significant signs of illness that would require treatment in the emergency department, that they don't stay away out of fear. We still want to ensure that our citizens get sufficient and appropriate care for their acute needs when they arise.
Thank you.
We'll take our next call from Greg Colgan, Woodstock Sentinel Review.
Hey, Joyce. I was wondering, do we have an idea how many people this person may have come into contact with?
We don't at this time. The staff are interviewing the individual and gathering that information. So at this moment, that information is not available.
Okay. And just one other question. Given that over the weekend, Elgin County and most of its municipalities declared a state of emergency, is that something that you would hope to see Oxford municipalities follow along, just because it kind of does enhance the seriousness of the situation?
The municipalities have indicators related to their internal resources and their capability to meet their ability to service the community. And they evaluate these indicators to determine whether or not they feel that they need to declare a state of emergency. I understand that Oxford has done a thorough assessment of these indicators and has not declared at this time. And so I think I suggest that you turn to them for further information on their plans. In terms of addressing the public health initiatives in containing the spread of COVID-19, we have been receiving significant support from our municipal partners. We are in daily contact with them, and we are working collaboratively to make sure we're keeping our community as safe and healthy as we can.
Great, thank you.
We'll take our question from Alvin, CBC London, and come back to Rob.
Hi, Dr. Locke. I understand that this first patient came into contact with someone outside the region who has the virus. Now, are there any signs in this case to suggest there's community transmission?
It does appear that there is community transmission in this particular case, because as far as I understand at this point in time, this particular case did not travel anywhere and would have obtained it from his contact, who resides in the other region. So that, by definition, is community transmission.
All right, and just to follow up, do we know what region that other person is in?
For privacy, again, I can't relate that.
Thank you.
So that concludes our conference call for today.